yours. Don't
Clementine,
forget.
thank you very much. I appreciate it. It's great to be here and finally kick off this webinar. Glad to know that people are interested indeed in the intersection between physical activity and health. I'm extremely happy as the Secretary General of ISCA, the International Sport and Culture Association, to kick off this webinar and to try to moderate this morning session. So what I would like to do in the beginning, in fact, is to not start speaking all by myself, but rather to engage you as well. So before I go into a little bit more practical information, I would suggest that we hand back to Clementine to have a poll, so you have a chance to share a little bit more about yourself, your status, and your knowledge about health enhancing physical activity. So let's go to the poll straight away, and Clementine can tell you how that works.
Exactly. So thanks to all of you for being there today. We would like to know more about you. So to do so, I will ask you to go exactly from the Q&A tab. So going to the three small dots on the right-hand side of your screen and to select polling. In there, you will see that we ask you 3 questions. We invite you to answer all of them. Which one is to know which type of public we have today, so you can indicate us where actually the sector of work you are involved in. The second will be about your physical activity today, and the third one will be your knowledge about WHO recommendation in terms of physical activity. So really feel free to answer them. Once again, going to the 3 small dots on the side, on the right-hand side, next to the chat bubble, select polling and then answering. You are 37 now around the table. Already 20 of you has answered. Thanks a lot. It's very nice to have your point of view. When we will close this, we will be able together to see a bit what are the global knowledge and structure. You will have the result display for all of you. So from what I'm seeing now on 38%, 28 already have done answer those polling. So it's really fast to answer those 3 questions. Thanks a lot. We are now at 31 over 38. So 2 of you are actually ongoing of doing so. So perfect. It's really good. Let's see how it's going. So from what I first see, I see that some of you are still answering, but the majority of the public today come from the public sector, civil society. We have then 21 of you that haven't had the chance yet to go outside today. And 21 of you doesn't yet. No, actually 26 of you already know the WHO recommendations. That's very good. 92% of the participant has answered. I suggest that we stop here. If it's okay for you, Jacob, then we can all see the result and go through you a very interesting presentation for today. Sounds
For
good?
sure, that's great. Please do close poll.
Okay, I will close the poll and display the results, so you should all be able to see them next to your screen. I will give you now the presenter right and put your presentation on so that you can continue in this presentation for today. So give me just a second. Here you are, you can go.
Thank you very much. That's great. Thank you for answering the poll and engaging here. I appreciate it very much. And it's nice to see that we have people with some knowledge already. Some people even had a chance to be outdoors and maybe active already. That is also very nice, but it's good to understand where we are as a starting point. Let me explain a little bit and briefly before we go to our 2 keynote speakers about how we look at physical activity for health in ISCA, because we are really focused on making people move more. And we realized that health is probably the biggest driver for people to be moving, except for kids who think they will live forever and be healthy ever after. And when we looked at the broader aspects of mental, social, and physical health, we came to realize that the language, especially in the EU, is centered very much about healthy lifestyles. So then we took a look at the risk factors that are linked to healthy lifestyles. And obviously these are tobacco, alcohol, unhealthy diets. And we thought, what makes physical activity stand out from these risk factors? And for alcohol, tobacco, and unhealthy food, I think it's obvious that we should all want to have less of those. For physical activity, it's the opposite. We should want to have more. And so we think there's something specific in physical activity where it's different in the sense that in the other domains, we could say that we have something we could call an enemy, like the tobacco producers, the alcohol companies, the big food and big beverages. There's somehow somebody to blame. But do we have someone to blame for physical inactivity? Well, not quite as clearly we think. Lastly, we can say that it's to a certain degree up to ourselves to be physically active. And we do speak about the human right to move in ISCA, and we do have a rights-based framework where indeed it is the case that our duty bearers in the public sector to make physical activity more accessible, more affordable for the citizens. But yet there is still a significant individual component. So we need to promote positive movement behavior instead of prohibiting anything in particular. So as an organization called ISCA, International Sport and Culture Association, we have a starting point in grassroots sports, local sport clubs, often run by volunteers, but we have realized that we need to speak about the broader movement agenda and see how our sector could be relevant in that context. So we need to look at how we get physical activity incorporated in more aspects of people's lives and indeed in more settings. And that is the starting point for our international projects, where I will now just mention a few for illustration. So how can we look at different sectors that are engaging more sectors, more citizens in physical activity? We have taken a fantastic example from Finland, for instance, which is engaging hard-to-reach children in schools through a dedicated mentor that doesn't only make them active, and you can probably guess that Ice Hearts from Finland relates to ice hockey, but actually the mentor engaging the children in any kind of movement that they would like. The mentor helps the children also with the homework and the family relations, so it's a broader social agenda in this case. We also run a project around schools called Schools for Health. So obviously the schools are a very important setting for physical activity promotion. We also took a very difficult step at esports, and it might be counterintuitive that we look at esports, which is to some extent sedentary when we talk about moving more, but we would like to think that it's possible to engage children in their favorite activity, namely esports, and still make it healthy, still make them move, and perhaps also have healthy habits around their desire to be playing esports and gaming. We've been working a lot with integration of refugees through sport, through movement, and making sure that there's also a place for mental health and resilience building for this very hard to reach population. Mental health, as mentioned, is a big deal for us, and we would like to make sure we don't start only when people have a mental health issue, but once more try to promote positive mental health and understanding how physical activity can contribute to that. More specifically, I'm sure you're aware of the situation where many people in Ukraine and refugees from Ukraine are in strong needs of mental health support, and we believe that physical activity has a strong role to play in that. Also, we've been running projects where generations across the spectrum are coming together. So not only to have senior citizens being active, not only to have the children being active, but actually having them interact and be active together. And finally, we believe that sitting at a laptop is not necessarily good for your health, but we also see that digital tools can help both local clubs and citizens alike to be more physically active. So this is also a project that we've been running in ISCA. Placemaking is trying to take a look at how can we actually use the public spaces that we have to make them more attractive for physical activity and not just use them for buildings and cars, but rather to say this is a common space, it's our space, how can we make it an active space as well? ISCA also runs campaigns. We're running something called the No Elevators Day. I guess you can guess already that this is about taking the stairs when you're able to, rather than taking the elevator. And so we speak about day-to-day, everyday movement, not just the sport-specific aspect. And we also, with our partners from Hungary, running the European School Sport Day that engages more than 2 million children every year. So with this final slide, we would like to say that maybe the health agenda needs to be looked at from a different perspective. Maybe the movement pills that we talk about is something we should actually consider taking a few more of. And I would encourage you all to think about how physical activity and health actually relate, and how we can think differently about the importance of physical activity in everyday movement for citizens' health and well-being. So with that, thank you very much for your attention so far. And I now have the great pleasure to introduce Dr. William Bird, who is our keynote presenter number 1, and ready to kick off now with his presentation. Thank you very much for coming today. Thank you very much for listening to me as a starting point, and right over to you, William.
William, you need to unmute yourself.
Do apologise. Thank you very much, Jacob. Real pleasure to be here today, and I'm delighted. I'm so pleased that everyone knows about the guidelines already, and that the people have been out for 15 minutes, which I had to confess I didn't add to on that list. But also the work that ISCA is doing, the huge amount of work of something which is so important. So I've got, I'm going to go through for 20 minutes. Please have some questions at the end if you haven't got any. We've got about 15 minutes for my presentation, and then we'll then be able to repeat as well. So I'm going to be talking about physical activity, perhaps in a way that I've been looking at it for over 30 years now. And I'm going to start by looking at an angle which we don't often look at when we think about physical activity, and that's how the association with resilience. Jacob mentioned about building resilience of people and communities and how important it is. So we've devised this kind of matrix here where we look at the neurological things of safe, valued, and belong. That's what every human being wants. It wants to feel safe, wants to feel valued, wants to feel belong. If we don't get that, we get stressed. And then the domains of our life are the people around us, the place around us, and us, our purpose. And what we found is when we ask questions about those 9 little boxes to people in the game, which I'll mention a bit later on, called Beat the Street. So here we've got 2,136 people answering that question in a town called Ipswich. And you can see the dark areas are where people have got very low resilience. But you can also see the yellow is a mark of high child inactivity, and the red is high adult inactivity. And you can see how the resilience and the children, particularly the inactivity, overlap so much. So what we're beginning to find out is that sometimes you can't tell people just to be active when they're in a bad place. They don't feel safe, they don't feel valued, they don't feel they belong, because then the physical activity is another stressor on top of what they've already got. And we have to start where people are. So when we've got people active, you can see here that these are the questions. The first one is a bit small. That most people are trustworthy. Overall, I think my neighborhood is a good place to be. When people move from being inactive to active, these are the things that rise up. They trust people more. They think their neighborhood is better. This is going to be currently what I want to be able to explore my neighborhood. So these all rise up when people come active. So physical activity is not a unique thing for an individual. It's part of a system. It's part of the social fabric of a place. It's part of the energy of a place and the actual place itself. So if we get it all wrong and people are chronically stressed, and this shift from acute stress to chronic stress probably causes more disease in the world than any other single thing. Pretty much everything of diabetes, obesity is caused by this shift. And what happens is that causes unhealthy behaviors. We are fairly primitive still in our brain. When we become stressed, we want to save calories. Therefore, you don't want to become active. So when people are stressed, they become less active. Now, there's some people who've got lots of experience of being active in the past. Most of you on the call will actually use physical activity as a way of getting over that stress. But most people who haven't got that experience will find that activity now adds to their stress, because it is stressful becoming active. The body has to change and waste calories. So we become less active when we become stressed. And what we therefore have to do is not keep telling people to become more active, is to deal with that chronic stress, is to make them feel safe, make them feel valued, make them feel they belong, try to keep that safety. And these unhealthy behaviors fit in with diet and addictions and poor sleep. And eventually, you started at the top there, weak resilience, down to physical inactivity, and then you've got the obesity. And then you've got the things like chronic inflammation and mitochondrial dysfunction. This is where we get down to real science, real heavy science. And pretty much all the benefits of being active are due to the fact that chronic inflammation disappears. So let's go in now, drill down into the science. So first of all, when you become active, you reduce your visceral fat. That's the fat in your tummy, around your liver, around your gut. That's the dangerous one. You can see here in the orange that fat disappears. That drops down hugely when you become active. The blue is the subcutaneous fat, which interestingly is actually not that dangerous. Got fat around your thighs, it's not going to lead you to become ill in other things. It's the fat around the tummy, and that's what physical activity gets rid of in a way. And you can have a normal BMI, in other words, you can have a normal weight, but have loads of visceral fat. So these are the people who are completely inactive, but actually look reasonably thin. They're way worse off than someone actually who's a bit overweight, but actually very fit, which we'll come on to. So this visceral fat, so when people don't lose weight, but they become active, you have to reassure them that inside their body will be much, much more healthy, even if they can't see it on the weighing scales. Every time we're active, we release anti-inflammatories from our muscles called myokines. And these calm down the inflammation everywhere in the body, including the brain. So every time you're physically active, and particularly when you use the muscles, which is why that bit's so important, you get this wonderful sort of wash of anti-inflammatories. And it lasts for about 24 hours. And then if we can dive inside a cell and you look at the little mitochondria, which power us, but also look after everything in our body. In fact, they're probably the most important things. When you're sedentary, particularly when you've got a high calorie diet and stress, your cells, these little mitochondria rather, inside the cells, just start to produce loads more free radicals, way more than the antioxidants can cope. And those free radicals cause damage everywhere, particularly in the mitochondria, but also in the rest of the cell. And that damage is what causes some of the inflammation that comes through. When you become active, lots more antioxidants. Funnily enough, you get less of these free radicals. Your cell, therefore, is protected, and therefore you don't have that damage and that inflammation. Now, some of those little free radicals get to the end of the chromosome, to the place called the telomere. And the telomere decides how long we're going to live. If you have a short telomere, I'm afraid you'll have a shorter lifespan. And if you've got a long telomere, you're likely to have a longer lifespan and less disease. So the more free radicals that hit these telomeres at the end of the chromosome, the more it shortens them. So that's why this inflammation is so important. And we know that actually, if you're inactive, your telomeres shorten. Interestingly, and this is an aside, that the green exercise when you're outdoors actually makes those telomeres grow longer, even better than being inside a gym. So being outdoors in nature, actually, because of probably the stress is reduced even more, makes our cells live a longer, happier life, which means we're going to have a longer, happier life. And children who play outdoors in green spaces, they also start their life with these longer telomeres, which means they're going to live a much healthier life for the rest of their life. So it's so important that we start early with children to get their kind of runway longer so that they will have more protection from diseases. So if we go from this weak resilience to the left, we go down, this is called health creation. This is about building up communities to have feeling safe, there's connections with everyone, there's a beautiful place to live in, there's purpose in their life with lots of events going on. That will give us that protection. Then we go to what we talk about prevention in traditional sense, that's diet, physical activity and sleep, stopping kind of smoking and stopping toxins from the atmosphere, stopping obesity, and then you go into the treatment at the bottom. But this health creation is a bit that we've often missed out. Now, you all know the guidelines. We're in the UK a little bit behind the WHO ones because we have 150 minutes of moderate and 75 minutes of active. We now know that's 150 to 300 and 75 to 150. So WHO guidelines have shifted it even more so to try and make sure that we try and get a lot more than just that 150 minutes. But if you look there, what you can see is that in the middle is build strength. That's the strengthening of the muscles. That was often forgotten, the one that's hardest to do. And children, well, you've got that in the poll. It's 60 minutes a day, okay, across the week, but everything else as well. And for children, you know, we are seeing really quite low levels of physical activity now, and it is worrying. And we just have to get them engaged. They again need to feel safe. They need to feel valued. They need to feel belong as well. So what's moderate activity? Well, it's a walking, cycling on the fat, gardening, tennis, golf, and those things. Dance, something we're really pushing in the UK at the moment. The vigorous is the running. Basically, you can't talk very easily without having to take a breath, and that means you're doing a really good job of vigorous. The muscle strengthening is the one that people find harder, particularly if you're at home and don't go to a gym and don't have people around you. But it's about shopping as well, using heavy, trying to carry as many things as well. Gardening does it, using a TheraBrand. You don't have to go to a gym for that. Yoga, press ups, all of these things can be done at home, but you just have to have incentive to do it. And then balance, we forget about that, particularly as we get older. It's really important to hold those things together. So we now know the science behind it. We know perhaps some of the resilience. So now we've got to understand a little bit more about physical activity, because they're kind of some measures, different measures. There's the fitness, which is different from just physical activity. To get our fitness, we have to have a bit more vigorous activity associated with it. We certainly have to go into a zone where we're starting to get really out of breath as well. And if we look at fitness, those compared from the least fit to the most fit is a 4 times risk of early death and many of the diseases. So it really is cardiovascular fitness or cardiorespiratory fitness is one of the most important things we can possibly do. And it gets more important as we get older. So it's slightly different from just being active. They've got slightly different qualities. And there's a big question about fit or fat, and it still reverberates around that, what is it? Can you be fit and fat? Which is the best to be? Well, if you're unfit and normal weight, from this big study in 2020, it showed from a systematic review that the risk of developing metabolic disease was the arbitrary 1, okay? And then they looked at people who are fit but obese, and it dropped by 4, down to 0.2. In other words, it was just a fifth of what you would get if you were unfit. So here it's saying obesity is not the big problem here. It's about being fit. That's cardiovascular fitness. Okay, it's not just physical activity. So it's really important that we get a whole group of people now shifting to their fitness. And we don't measure it. It's one thing we probably should start to measure a lot more. And of course, if you've got that fitness and you become active, you can see here that your fitness gets up and your strength and balance on this one goes up and up in early life, plateaus out in adult life. And then if we don't look after ourselves, we go on the blue line, which means we hit the disability threshold early on in our older life, in our 60s. But if you look after yourself in adult life, that green line goes and you never get to that disability threshold because you've looked after yourself so much. So you've been to your 90s before you get any problem. So we've got this big gap. And this gap is causing so many problems for older people. Elderly people never in the past used to have all the diseases that we now associate with old diabetes and heart disease. Never used to be there because people were always active. It's new to associate older people now with these chronic conditions because we don't look after ourselves so much. And look at this, look at that 40-year-old triathlete with all that muscle around them. That's what you'd expect. And you'd expect a 74-year-old sedentary man to have lots of fat and tiny little bit of muscle in the middle. Here's a 70-year-old triathlete. Spot the difference between the 40-year-old. So if you keep yourself active, you don't need to lose all that muscle. It's just because older people tend to get less active because they're not working so much. It's a little bit more tiring, but you can do it and you can keep it going. And we compare antihypertensives, so blood pressure tablets of ACE inhibitors, thiazide, beta blockers, with physical activity and dropping blood pressure. Look at that, 29%, 41% on regular physical activity using tests, etc. Compared to the drugs, it's 3 or 4 times more effective than the actual tablets with all their side effects. And we know that it's pretty much as a golden rule, it's about 30% reduction of everything. Colon cancer, depression, type 2 diabetes, cardiovascular disease, hip fractures up by 68%. But this is a right across the board. Well, we've seen what happens in the cells, we've seen what's going on. And in the brain, the hippocampus, which deals with our stress level, that actually goes up by 20% if you're more active. And we saw also in nature, it pushes it up as well. And if that hippocampus gets bigger, it calms down that chronic stress, because that's where the trigger is. So you can start to see how physical activity eventually does help someone cope with chronic stress. And even the bit from the prefrontal cortex to the amygdala, that connection, which is so important to dampen down so that we don't get scared of everything around, we're not hypervigilant, anxious all the time. When you're inactive, that becomes faulty and you become anxious about everything, because the amygdala hijacks your brain almost, and physical activity calms it down. And even just a walk 20 minutes for children, you can see here how the brain activates itself before lessons. If they've walked to school, makes a huge difference. Depression increases a brain-derived neurotrophic factor, which repairs the brain. It's anti-inflammatory, has its effect on stress hormones, and obviously resilience as well, which we've talked about. So depression is reduced as much as antidepressants. People think their hips and their knees will give way if they start walking again. It's the opposite. Their hips and knees will actually bring up the cartilage, and that cartilage will start to get thicker. So it's not wear and tear, it's wear and repair. And that's the doctors have got to change from this wear and tear to wear and repair. The immune system, natural killer cells are increased. They stabilize the immune system. So those who are active before COVID actually didn't have so many of the complications that we saw during COVID. And the heart, well, there's so much going on there. Your blood pressure drops, your inflammation, your fibrinogen disappears, your blood vessels widen. So not surprising that physical activity affects that. And type 2 diabetes reduces that significantly. You can reverse type 2 diabetes. We're seeing this increasingly with both diet and physical activity. But we can, type 2 diabetes shouldn't be around. We shouldn't have any of it. We should have just 1% of the population, not a ridiculous amount. We spend £1.5 million an hour in our NHS on diabetes. An hour, not a day or a week or month or whatever. It's shocking. So cancer, almost all cancers, particularly breast and bowel, where the effect is best known. And then, of course, as we've seen, that disability increases as we get older. And if we're becoming active, we stop ourselves going into that disabled area. So just a bit of work on what we've been doing. So we've actually created a game called Beat the Street, which had almost 2 million, I think it'd be 2 million people will have taken part by the time we get to February. And we've reached 27% of all schools in the UK. So we use a card and we use little beat boxes put around, but we get about 13% of the local population. That can go up to 24%, and 50% of all children take part. So this is a real way of reaching communities to give them an example of the parks and the green spaces and the activities and the community groups and everything else that's in there. And if you look here, when we see here, this is 17,000 people we followed up and did a match pair. And we look at the people who benefited the most. So this is inactivity falling. And those are the mental health condition, and with diabetes and disability, they all did really well. So it shows if you reach those people who are probably very inactive, you can increase their activity levels hugely. And it therefore kind of hits the right people. With children, here we followed up about 11,754 children, and those with a mental health condition, again, their activity levels dropped partly because they started to feel safe and that trust started to build up. You saw on that very first slide, those things. Trust was the one thing that actually improved when we were talking about the people getting more active, and also adult life satisfaction. Again, we got here 10,000 people we followed up and asked them about the ONS, which is a government form of asking 4 questions. And again, that went up with those particularly with mental health conditions. So we can scale this up, and then you can ask questions and find out in pockets of their resilience, their life satisfaction, their inactivity, their nature exposure, the community assets, the child independent, and put it all together and highlight streets and areas where you can target those groups who need to have that physical activity. And you've got to start where people are. They're frightened. They're in their houses. They don't want to come out. They keep their children close to them. We have to allow them to feel, again, safe, valued, and belong to get them out. And we can go down to roads even and understand what's going on. So that's what we're doing in the UK at the moment. And here's Merton, which is a place in London. This is deprivation. So the top left is all leafy suburbs. The right-hand side is more deprived area. Guess where the inactive people are? Remember that picture? Bang. Look at those inactive people on the right-hand side compared to the leafy suburbs. It's almost divided in two. That's 4,800 people we got to answer the question about their activity. And then look at children, absolutely the same. So this is because we need to really understand what it is that is stopping those people from going. And look at this, you can see here in that little blob in the middle of ethnicity of black people, and you have a park down the bottom right. So you should expect an equal amount of people around that park on the bottom right to be going into that park. But when we look at the people using that park, it's none of those who in the black area. So this is because the ethnicity is impacting people wanting to use the park. We have to understand why. We have to start to look at that. And
Yes,
then Burnley here,
William, I also want to make sure that we have time for questions and answers. So please consider wrapping it up. Thank you.
Last slide. The last thing we're just doing is we're training up doctors as well. So we're working with the Faculty of Sports and Exercise Medicine and the National Centre. So we're trying to get as many people, doctors as possible, to understand about physical activity. And we've managed to get about 17,000, in fact, over 40,000 over the years. So important to get them done. And green social prescribing and social prescribing in this country is starting to get an interest from the Treasury. So thanks very much, Jacob. Hopefully we'll have some questions from you. And I did, apologies, go over 2 minutes.
Thank you, William. I appreciate it very much. I do think I have 100 questions myself. Let's hear if our audiences have questions. Let's hear if there's somebody that dropped a question indeed in the Q&A so that we can get the conversation going. But it's an awesome amount of information, impressive and depressing, some of it, what you've been able to share with us. Thank you very much, William. And I open the floor to my colleagues to share questions from the Q&A or to raise questions on their own.
Thank you so much. We have one question from the Q&A, and I will urge other participants as well to use the Q&A tab to submit theirs. And Jakob, you can prepare some from your hundreds questions that you had in mind. But William, I'll start it off with a question from Miguel, who comes from the physiotherapy world. And Miguel is asking, with all the benefits of physical activity, and with physiotherapists being the health professionals who are experts in movement and prescribing exercise and adopting it to the condition of each person, why are they often forgotten in this type of initiatives? Do you have any insights from there and the work you've done in the UK around this as well?
Well, I have a conflict of interest because my daughter's a physiotherapist, so she'd be very much sure to probably ask exactly the same question. So I think the physiotherapy is all absolutely essential. And I have to say, you're absolutely right. For some reason, when we've gone out talking about physical activity, it's very much been medical led initially, with sometimes nurse practitioners coming in. And the physios have been doing this work for years, well before anyone else came on. So why aren't they joining up? And I think we are starting to see it, but it actively has to be done. There has to be a way that we're all focusing on the same agenda, we're focusing on the same end. We have to build that trust sometimes in the health service, we're not very good at all working together in teams. So we have to get that trust with the different professions. Physiotherapists have got a real expertise clearly on most of the rehabilitation and ability to get people back again, if they've got long-term conditions, if they've got post-op, if they've got injuries. But generally, they're there to do just exactly what I've been talking about in getting people more active. In the UK, they have started now to work a lot more closely, but it's taken time and it's still holding back. And I think this is a real shame because I think both sides are missing out. So I don't think I've got the complete answer of why it's taken so long for the physios and the other public health and medics and things to work on this same agenda. But knowing their skill set and knowing it very much in our family, I feel they're absolutely ideally placed, and we've just got to work together more and just try and get rid of that professional kind of identity that we kind of separates us all so often in health.
Thank you, William. If I may ask a question,
yeah.
If I may ask a question of my own, then I would just like to come back to what you've done in a very fascinating way, is to connect physical activity to a broader range of topics. So you talked about resilience, you talk about poverty, vicinity to facilities and access, and that can be somehow empowering to see that we are part of a bigger challenge and bigger questions. On the other hand, it can also be difficult to see where do we then start. So knowing that this is linked also to inequalities and resilience, etc., should we give up and wait for systems to change and governments to do their part? Or what are the ways that you would recommend that we get started tomorrow in terms of promoting physical activity in what is obviously a very difficult social, political and economical context?
I think you're right. I mean, I think governments trying to help, or local councils trying to make the place a better place to become more active is clearly their role, and that's got to happen. But that doesn't mean we wait for that to happen, as you know. I think one of the things we're learning and Sport England is putting a lot of effort and a lot of money into place-based working and system working. So we're looking at systems, and what we're finding is that when you get the community engaged and they start talking to each other and you start these networks and linking and you're connecting to green spaces, then physical activity starts to come out almost by accident. You don't need to come in with a big physical activity hat on and say, hey, we're going to make you all active. You just make their life better. You give them that safety, you give them that purpose in their life, you give them something which is enjoyable and fun, and suddenly you'll get people walking around with each other and you'll get people turning up and you'll start to feel streets. Now, we created a game to try and do that. It's only for 6 weeks. But what people are finding, and particularly parents, are saying, I didn't know there was a park down there and I'm going to use that now forevermore. I didn't know I could walk to school so easily. I thought I had to go in the car, but I've done it for 6 weeks. Now I can carry on. So you kind of have to open their eyes, but it's got to make it safe and you've got to make people feel valued. And I think that's the bit we often fail to remember, is that people are quite scared of going outdoors with their children, going to some big park. And I think that's the key thing that we really have to work on.
Thank you for that insight. I had a follow-up question on that specifically. So you mentioned the Beat the Street program that has a 6-week intervention, and people discover these new parks, areas in their local community where they would be active. Do you also see them being more advocates and activists to demand more of their local municipalities? Because that would be one of the keys if we would have people advocating and asking for physical activity and green spaces on the local level. That could be a movement in itself that could make a difference. Do you see any of this happening through the programs that you've run?
Yes, because we ask questions about their resilience, but we also ask questions about ABCD, which is asset-based community development. So that's basically, do you feel part of your community? Do you feel you volunteer? Do you help out? Do you feel, there are 5 questions we ask, and all of those increased with those people who became active. So you're creating more engaged citizens, and it may be Beat Street, it may be other things, but every time we get people to get out of their house and go into the public area, whether it's events going on, which ISCA do loads of, every time there's an event or there's a community group or there's something, you're starting to get them becoming advocates of. And I think the question that we find the most discriminating is the one, this is a good place to bring up children. That shifts hugely. So that's really low. in places of deprivation, and then that shifts a huge amount because they suddenly realise it opens their eyes that this can be a great place, and then they become part of that solution as it being a problem, which is where public health can very often see people as problems. We've got to see people as solutions, and that's how we've got to shift ourselves. And then they will, and they've got the power. They've got the power to make it happen.
That's wonderful. I love that. We need to see people as solutions. That was my key takeaway. There was also some questions in the chat, and I would encourage you, William, if you can answer those in the chat, if that's okay. It was a questions about what is the role of cities and promoting physical activity, and what could be the indicator sensors that could help us to mark the improvement. And I know you have plenty of materials in this topic as well, so I'd ask you to reply to that question in written format, and we will continue with Naomi's presentation. So thank you so much, William.
Thank you very much indeed. Real pleasure.
Indeed, thank you very much. Most appreciated. Do stay active in the chat. Do use the Q&A to raise questions to our speakers. And now it's my absolute pleasure to take another step at how do we actually tackle this inactivity crisis on practical level? How do we bridge between physical activity and health? And I'm so pleased to have Noémie Ferrer with us today from a French perspective and looking at how they actually have done their part to make citizens more physically active. So over to you, Noémie. Thank you very much for joining us today.
Thank you. I'm glad to be here with you today to talk about physical activity for health. And to begin, if you are sitting, I invite you to stand up and to make some movements to fight against chronic inflammation and to keep your telomere long. Right? So, thank you. I'm Noémie Ferrer. I'm a public health physician, and I'm also a teacher of adapted physical activity. I'm part of the board of the NGO Azur Sport Santé, and I've been working on this topic for 10 years now. So during this presentation, I would like to share with you scientific background and concrete action that could be implemented in Europe. A few words about Azur Sport Santé. It's an NGO established in 2015 in the south of France with the support of the Region Health Agency. It was created to promote health through physical activity and to encourage physical activity among those who are distant from it. Azur Sport Santé is an independent organization funded by individuals from the field of healthcare, physical activity, and research. We are today an association of general interest and an official training organization. Our purpose is to develop physical activity as a health tool throughout life, and our values are based on inclusion of all the citizens. We try to have a community-based approach, and given that our organization has been found after a scientific study, we always try to keep the quality process by adapting and modeling our actions. Here are the 3 areas for the implementation of our mission. We have a well-developed communication strategy that includes sharing both scientific studies and practical good examples. We communicate daily on the social networks. We offer guidance to all actors interested in developing physical activity projects. This includes community and federation, but also small local associations or individual coaches who are working in the physical activity field. And numerous programs are organized for all categories of the population. Some of this action will be presented later on. And we try to be the leader when it comes to testing a new approach that can later be duplicated in other areas of the region or even on a national level. So, for example, Regional Health Agency mission us to create the platform that addresses those who are looking for physical activity but do not find the right offer among the sport clubs or federation. The interactive map, you can see here, proposed about 300 offers on a regional level. after years of work on developing the network, of course. So I'm going to go quickly on this part because we've already talked about it. But I would just like to recall here the definition of health, which is not merely an absence of disease, but a state of physical, mental, and social well-being. The key information here is that sport and physical activity are not synonymous. Physical activity is any bodily movement produced by a muscle. And the other one information is that sedentary behavior and physical inactivity are not synonym to. Sedentary behavior is the time spent awake with energy expenditure close to resting levels, and physical inactivity is the fact of not reaching the recommendation. So in France, we often say sitting is the new smoking to highlight the bad effects of sedentary lifestyle. 70% of Europeans underestimate these risks. And the number speaks for themselves. Screen time has increased about 50% among adults in 10 years. So I will present you here French data, but the context is the same at the European level. This also concerns children. 4 hours a day, it's the average screen time among 17 years old. Speaking of children, their physical capacity have dropped dramatically, around 30%. And 4 in 5 children do not meet the physical activity recommendation. So we have a big challenge ahead of us. To be more positive, here are the main benefits of physical activity in disease prevention. As you can see, physical activity reduces diabetes, Alzheimer's disease, coronary heart disease, and other vascular disease. It delays osteoporosis, and it reduces risk of many cancers like breast cancer. It also improves the quality of life with an action on maintenance and of social connection, immunity, breath, sleep, mood, and mental health in general, and it prevents autonomy loss. And the good news is that there is a dose effect response. So even by practicing 24 minutes per day, it will reduce the risk of mortality by 60%, and even 15 minutes would reduce around 20%. So how to reverse the trends now? The 2 key ingredients for implementing quality action are to seize every opportunity for practice. So leisure activities like sport, walking, hiking, environment and commuting, domestic tasks like household, beneficial for both women and men, and work or school place. The second ingredient is to take into account all the factors that influence our level of physical activity. So it's written very small here, but you're going to have the presentation after. So we have individual factors like age, gender, or self-esteem. The environmental factors like the place you live, the place you work, your family, your friends support. And political factors like the government, health system, and sport and leisure industry, for example. So I would now like to share with you 6 examples of concrete action in real life carried out in France. The majority of the action took place in the city of Nice, which has 350,000 inhabitants, or in the Thousand region, which has 5 million inhabitants. So the city of Nice have been working on creating physical activity-friendly environment. Some of the most relevant examples are the biggest park in the city center. You can see on the picture on the left. that has been created 10 years ago, replacing a huge parking area for cars. More than 100 of cycling lanes have been created during the last decade, and as part of a partnership, the CATRES project made it possible to build a walking route adapted to seniors. This research project was conducted by the city and the Public Health Hospital of Nice. As part of a urban renovation, it required many skills, including those of a geographer and those of the local residents, to build this route. Azur Sport Santé has a community-based approach in almost all the projects. We have worked with the National Museum of Sport and local stakeholders to create the giant active design area in front of and around the museum. It makes the whole space more attractive for physical activity with numerous simple challenges. Within the placemaking and sport project, we have worked with the local community to implement a giant board game called Move Game. Before it was a board game, just board game. The painting active design represents a sustainable solution. We have created an interactive website so that all the citizens can use the game. They only need a smartphone to scan a QR code, and after they are guided through the game. We pay particular attention to the promotion of simple active behaviors like taking the stairs or active commuting. We have joined ISCA network, and every year we organize the No Elevators Day in our building, engaging dozens of employees. We use various posters, you can see them on the right, to follow up the event with the hope that it can become a healthy habit and not a one-day challenge. And for the European Week of Sport, we organize physical activity sessions, and we also propose raising awareness workshops to promote physical activity and its benefits. Now, the Prevention Active Senior project is based on scientific proof and recommendation. The aim was to create sustainable physical activity offers for elderly because we found that there was a lack of it, especially in a rural area. So we have provided a guide for the professional, and we co-create this action with a local mayor and sport professional. It wasn't always easy because we didn't all have the same representation of physical activity. And since 2017, more than 1,500 elderly participate in over 150 programs organized in 80 cities. We observe a positive evolution of physical capacity and health perception. And we were happy to see that the rate of satisfaction was very high, 99%. Active Attitude now, it's a 5-month program for unemployed women from priority neighborhoods. The main goal is to empower these women by improving their self-confidence and self-esteem to allow them to find work or a professional training. The program combines physical activity and other activities like theater, job dating, digital skills, and individual guidance during the 5 months. The whole program is co-designed with the participants. They will choose the activities and express their needs for specific development and guidance. According to the satisfaction, the key element for the success of this project is the social dimension of physical activity due to being in a group. We are proud that more than 60 participants over the 5 sessions improved their self-confidence, and that 60% found work during or after the program. Maison Sport Santé, so physical activity houses, is a national device. It's a tool for equal opportunities and access to health rights through sport. These structures are supported by health and or sport professionals. The target audience is people in good health far from physical activity or people suffering from chronic illnesses for whom physical activity is recommended. The first step is to carry out an assessment, taking into account people's need. And the goal is to help people to integrate physical activity into their daily life. The structures also have an awareness-raising role with local stakeholders. And we have today about 400 Maisons Sport Santé on the territory. And finally, Planet. Planet is a toolkit to promote physical activity in therapeutic patient education, which is a structured person-centered learning process for individuals living with chronic condition. It is carried out by trained professionals, and Planet was a partnership work with the help of healthcare professional, patient association, and adapted physical activity coaches. It contains user booklet, card game, photo expression, game board, and digital support with various activities like videos. The four main themes are motivation, knowledge about physical activity, choose your physical activity and access it, and plan your physical activity practice. And the objective was to provide healthcare professional with ready-to-use resources to better integrate this dimension into programs, whatever the pathology concerned. And all the activity proposed have been pre-tested by caregiver and patient. So thank you for your attention, and I will be happy to answer any question you may have with my colleague, Colleen.
Thank you so much, Naomi. It was a wonderful presentation, and thank you for also providing a lot of solutions to these issues and real-life examples and programs, and have a 99% satisfaction rate with 1,500 participants is wonderful. So it's really great to see the work that you do, especially in disadvantaged target groups or in rural areas. Coming to the questions now, there was a question on outdoor activities and outdoor sports, and I think you provided a lot of examples from that. So you answered the question during your presentation, and thank you for sharing the links as well. And there was one more very specific question, and maybe William, if you're still online, you're also welcome to chip into it. But we have a question from Badon. I hope I'm okay with my French pronunciation. And the person is asking, can you be physically active but still have a sedentary behavior? And the example is, let's say you train every day for 1 hour, so you do 60 minutes of physical activity, but you spend the rest of the time sitting or in sedentary lifestyles. Would this also lead to health issues still, if you have any insights to this?
Yeah, that's completely true. You can be you can have a sedentary behaviors and be active, and there are different risk factors. William talked about chronic inflammation. So we know today that if you spend a lot of time sitting, you will have very bad effects on chronic markers, and that you have to act on the both activity and sedentarity.
So it's actually increasing physical activity and reducing sedentary lifestyle.
Yeah.
Both of this. Okay. I see William, you unmuted. Do you also want to chip into this topic?
No, just about. I mean, Ferrer just answered it really well. I think there used to be a worry that the weekend warrior, as they used to call it, these are the people who exercise very much at the weekend, and then they do nothing for the rest of the week because they're working, sitting down all the time. And that used to be thought to be really bad. But the evidence has shifted a little bit, saying actually sedentary behavior is bad, but actually the weekend warriors are probably not too bad, not as bad as we thought. Now, nobody will say you've just got to do nothing for 5 days. You don't want to say that, but it does show, as Ferrer quite rightly said, there are two different aspects, two different risk factors, two different things. So although get as activity when you can, so if it is only a bad month you're going through and you can only do it at weekends, fine, but really, really try and break up that sedentary behavior because, as Ferrer said, it causes chronic inflammation and all the problem. Just getting up every hour. I mean, I don't think we haven't quite got the research identifying exactly what it is, but probably 2 or 3 minutes every hour getting up is going to break it up, but as much as possible, really.
Perfect. Thank you for that. And I would also like to emphasize that the World Health Organization, WHO, also in their more public-focused campaigns has the message of every move counts. So do as much as you can to integrate it into your daily life and habits. So I think that's a very good message to keep in mind also for ourselves in our own professional life, that we probably spend behind the screen sitting most of the time. So just a reality check for all of us in the call. And we have one more question from the Q&A, and William, because it's related to also what you presented, so I would direct it to both of you. There was a question from Chiara, if there's training courses for physical activity professionals about how to include individuals with mental health issues. William, I know it was in your presentation, but Noémie, do you also have any specific experience with individuals with mental health issues in your work?
Not specific issues, but I know there are a lot of, in France, there's a lot of training course on this topic, especially for schizophrenia. Is that the good term? Yeah. And we know there's a lot of benefits, but it's true that it's specific public, and we need to adapt exercise and action when we work with this public.
Thank you. William, do you want to chip into this one as well?
Yeah, I think all the programs that Noémie was mentioning, all help. The more because it's getting people in a safe place, and if you've got mental health, you often are feeling quite scared, and it's quite challenging, and we forget that you have to start where people are. And for those with mental health, just turning up to the event, not taking part, can be a big thing. So let them turn up for a few times, have a tea or coffee or do something, and then get them to build very slowly up. I remember a lady for a walking group, and she just made the tea and coffee for everyone for a year before she went on her first walk. But she needed to feel comfortable. She needed to know everybody. She needed to have that kind of feeling of safety. So there is absolutely a different way of looking at those people with mental health. The physical activity clinical champion thing, I have put the link in there. They're working on something for mental health. So this is the Faculty of Sports and Exercise Medicine, which is the overarching under the Royal College of Physicians. So it's all the experts in physical activity, and we've got the general presentation for everyone, or adults, and they are making one for mental health. It's not there yet, but it will be coming. I've sent the link to the site which we're involved with, but yeah, it is a very different group of people. And actually, even people without mental health problems, they do have scared. The physical activity is quite a scary thing if you've not taken part. And for those of us who are active, we don't sometimes appreciate that.
Mm-hmm. That's a very valid point as well on how to make
maybe
sure.
add something as well, Laura.
Yeah, Colleen, go ahead. Yeah, of course.
Nice to meet everyone. I'm Colleen from Azur Sport Santé. I'm working with Noémie. I just wanted to add that every year in France we have a great national cause, and next year it will be on mental health. So we actually hope that on the field of physical activity it will be highlighted more, because it's a public that is not very in the center of attention, let's say, and we are very into working on that topic next year, especially with this great national cause. And we also are going to write several memos about this topic and physical activity for each disease. It will be in French. Maybe we will translate it in English. But if there are anyone on the webinar that wants to know more about training in French, maybe we can keep in touch later. I don't know, especially because Chiara asked for that, but I don't know any specific training on that topic especially. But I know training most of the time when you are on adapted physical activity, you have part of courses on that topic, of course. So if we need, we can also keep in touch later.
Perfect. And thank you for that feedback. And if there's any other participants on the call who know these resources, this is also part of the knowledge sharing and learning from each other. So if you know anyone, anything doing this work internationally or on the national level, please share these resources in the chat as well. And we have some from ISCA side as well. And I see that Jakob has raised his hand. So I hope you're chipping into this topic, Jakob.
Sure, I would like to comment specifically on the question of mental health. I did mention it also in my introduction that the program called ABCs of mental health is actually a very, very interesting approach. ABCs is the act, belong, commit. So acting is doing something, ideally physically active. Belonging means that you do it together with somebody else, and committing means that you also do it for somebody else. And all those three elements is actually possible to implement in all kinds of community settings, not only in a sports club, not only in the local elderly home, not only in the municipal setting, but you can actually apply these principles across the board. So it empowers us all to actually try to do something to promote mental health generally. So I wanted to share that. I also wanted to raise a question on my very favorite topic of them all, namely money. And I wanted to ask the colleagues from Azur Sport Santé, how have you actually made it interesting and possible for some of the participants to also pay for the activities themselves? It appears to me that if you've provided some of the participants in the test pilot programs, after they've tried it, all of a sudden they realize the value and then they're ready to pay. Is that correctly understood? Is that a formula to make sure that participants, when possible, can also start and co-fund some of the activities? I would love some more comments on that.
Colleen, do you want to answer?
Yeah, actually, on the program Prévention Active Senior, we had several questionnaires at the beginning and at the end, and it was a completely funded program by the region and some departments as well. So it was free for the participants, but we make them aware at the beginning of the stations that of course, having coaches and having a build program was not free. And we asked them at the beginning and at the end what costs they will be able to pay or they will be willing to pay. And the result was completely different at the end. At the beginning, and I'm not pretty sure about the result, but I remember that at the end, they will be able to pay more. That's what they answered at the beginning of the program. So they really valued especially the sociality about the program, the fact to be together, not to be isolated somewhere, the fact to share with others, the fact to be in better health, the fact to have a meeting, you know, a special time during the week that you know that you will meet other friends and the coach, and they will be actually they have been willing to pay for that. And I think on Noémie presentation, it was around 70 euros for the average answer for that. And there are actually most of the programs have been implemented in cities, and now they are paying for that. So it's quite a good result, actually.
Thanks for sharing those details and also, you know, showing the participants the value of it, how much they enjoy it. But maybe the first step is difficult for many people who might have stress around physical activity, anxiety, this trust issues of is this for me? And taking that first step is very difficult for many people. And I wanted to ask you also, Colleen and Naomi, from your experience, how did you see this in the post-COVID era, both for a younger age group, but also for the older age group? Did you see a more resistant, hesitant social anxiety around starting with social group activities? And how has this passed, or is this something that you still need to deal with?
I don't see, maybe Noémie can also add something, but I don't see any difference between before and after COVID on the fact that people are involved in the program we are offering. And we have several types of person. We have the women unemployed for active attitude. We have elderly people for Prévention Active Senior. We have a lot of children in schools, but they are in schools, so it's not really relevant, I think. We do have also a lot of programs for companies, like people who are working. And I just wanted to add the fact that Noémie was talking about the difference between inactivity and sedentarity, and that we have to fight both. And in Azur Sport Santé, we have a YouTube channel with a lot of videos. We call that pose active, so active pose, let's say in English, to fight against sedentarity. So we like to encourage people who are working in offices to do this kind of pose. They are about 2 minutes to 4 minutes, every 1 hour and a half or 2 hours maximum work. And we do ourselves, and we train a lot during our work days. Yeah, I'm sorry, I don't see any difference on our public before and after COVID. Sorry for that.
Yeah, it's a good thing. I mean, in some countries, it's a huge issue because young people face a lot of loneliness, social anxiety, being in group
sorry
settings.
about
So
health. Yeah, of course, but we don't have any program, especially on that matter. So maybe it's why.
Okay.
Yeah, we have worked with young people on GUM project, of course, but I think the amount of person we saw is not high enough to see how to say a trend.
Yeah. Okay, thank you for those insights. I will hand it over to Jakob for any reflections from his side and brief reflections, and if you want to ask anything else from the speakers today.
Thank you, thank you. I think we've covered a lot of ground already. It's been fantastic and great to make the transition also from William's introductory starting point with a lot of the science and the knowledge we have, and then having some very real life examples of programs that make a huge difference in people's lives. So bridging the challenge and the theory with also some of the practices that actually make things work on a day-to-day basis has been fantastic. Thank you very much for contributing. And it's now my pleasure to start the end of the webinar. That is handing over to ISCA President Mogens Kirkeby for some reflections and remarks. So over to you, Mogens.
I think I needed to be closed. Is that correct? Okay, thank you very much. First of all, thank you very much to Colin, Noémie, and William for telling us different ways to keep physical activity staying on the agenda, staying on the personal agenda, the societal agenda, but not least the health agenda. And I would say the product, physical activity, it's quite a fine product. It can create better health. We learned it's not only about us as persons living a longer, healthier life. It's also even our individual cells, as William said, that the cells need to live a longer and happier life. It's also, in some cases, quite affordable, and it can also be social. The problem is that sorry.
You need to start the share screen. This is only the background.
Sorry. Yeah. The problem with this activity, as we call physical activity, it's rather complex. It's not a product you buy, a pill, and then you swallow it, and then it's done. It's complex because you have to produce it yourself. And as it was also mentioned, for some, it's quite scary. So why would you start producing your own physical activity if you even believe it's scary? It's a complex, especially for those we would like to be more or create more physical activity with or for, because it's about changing habits. And I think we all know, if we are at least plus 20 years, that changing a habit is rather difficult. But it is activities, as also mentioned here, it is a product that delivers to other sectors. It's not only a in the sector itself, we are from the recreational sports sector, and it delivers, of course, in that sector. But as mentioned in these examples, it delivers to other sectors. It delivers strongly to other societal challenges, and not least, today we speak about the well-being and the health sectors. But I'm afraid to say, and that fall on our sides, that it is very badly communicated. We are not, from our sector, able to communicate these effects, the impacts, and the good things about physical activity in a way that it is, so to say, reaching those in other sectors that we would like to assist us in helping with doing that. We are trying to communicate it in various ways. In ISCA, we call it human right to move. We very specifically use the word move more than sport, because we think there's a wide acceptance of moving. It can be sport, but we think there's a wide acceptance, and therefore we try to address it with the right words, and the right words are not the words we understand, but the right words that are accepted by other sectors. As a sector, we of course have the challenge to try to increase physical activity among citizens, and it's easier said than done. We see trends going the other way. But I think that's an ongoing issue, and you've heard solution about it today. But if I could, at this time of year, make one wish to all of us trying to do that, it would be the wish to communicate impact. I think we need to communicate in language where other sectors understand, or at least should understand, our communication, and impact is one area that could be relevant. I would like to show one way to communicate impact. There are many other ways, but I'm just taking now the liberty to take a situation from Norway, and this is a website of the Norwegian Health Directorate, and here we can put in a number of people that we would like to calculate for. Let's say we put in 1,000 people, and then we say they are from the year 50 onwards, they will change their habits, and we say they change their habit from physical inactivity to a little active, and then we calculate. And then we get the numbers here that if that's happened, if we make 1,000 people change habit from the year 50, from inactive to just a little active, the statistic says that then we gain more than 7,000 more healthy years and 3,600 extra years. So these statistics, and this is not rocket science, it's based on reality. And with such an impact, you can ask those who are investing in better health, what is then investment worth? What should we invest to create this for these 1,000 people? So this is one way to explain and to illustrate impact, and I think it's important that we in our sector speak this language of investing or showing impact to create more investment. 10% of GDP is the average in the European Union, the average country spending on health. 10% of all values created in your country is spent on health. And the vast majority is not spent on prevention. The vast majority is spent on cure. It's a huge amount, and therefore I think if we can communicate impact, there is a chance that we can also illustrate that there will be impact of investment done in our sector. We are on the agenda, on some health agendas. We are not as high as I think physical activity should be. And there will also be other things climbing that agenda. Just giving one example, that screen time, some governments have taken measures to stop or decrease children's screen time. And that's important, but it's just also saying that there will be other things climbing the health agenda. And if we are not able to create or show impact and leverage investment to make impact, somebody else will take over. So my wish this time of year is that we all start to communicate a little bit heavier on the impact. Thank you very much.
That sounds like a challenge and a fair request to Santa or whomever you want to ask to make sure that we take up this good advice, Måns. Thank you very much. Indeed, communication and making sure that we talk to others, that only our own little bubble, is so important. And I'm glad to have shared examples today, not only from the grassroots sports sector, but from all kinds of sectors on how we can make more people physically active. So with this, it's actually shortly before time. And I therefore have my own Christmas wish to all the participants, that if I manage magically and somehow not very often to end a meeting or a webinar before time, the last time should not be spent on sitting down, on typing emails. I would encourage or even request or tell you to consider using that time to be a little bit more physically active. Walk and get a coffee if you must, walk around the table, do a squat, whatever. And remember that it's also not just about your own physical activity, but if you do this, you might have an influence on the next person, or somehow otherwise make sure that you communicate that you can do this and others might feel the same as well. So let me end by saying a huge thank you to our speakers for contributing today. It's greatly appreciated. We do owe a lot of thanks also to Clementine and Abigail for supporting technically to deliver this webinar, and you will have a chance to also answer with your suggestions for improvement, so an evaluation survey after this. But I will hand it over to Clementine to wrap it up, and do not forget, take the last few minutes to be a little bit more active. Thank you very much for joining today.
Thank you very much, everyone. I wish you all a very good day. When you're gonna leave this session, you will have a little survey that you can fill to help us improve those webinars and improve how to address to you this topic. So please answer it. It will be a very help to us. Have a great day, everyone.